Okay, you are called to the scene of a construction area where you find a victim who's fallen 30 feet to the ground. You find the patient lying in a pile of debris under scaffolding. The victim is found lying face up with his arms and legs close to his side.
Okay.
And the head is in a neutral position.
Okay, I'm going to arrive on scene. I'm going to have my PPE. I'm going to have my gloves on before I get out of the ambulance. I'm going to assess scene safety. My scene is safe.
Yes.
My mechanism of injury appears to be a fall. My number of patients appears to be just one.
Correct.
I am going to go ahead and call for ALS backup due to the mechanism of injury. And I'm going to have my partner hold C-spine. So then my general impression of the patient is poor. I'm going to assess level of consciousness. Sorry, I do have a knee issue, so I'm slow. Hey.
No response.
No response. I'm going to do a little painful stimuli, grabbing here. Any response to painful?
No response.
So my AVPU, he is unresponsive. I am going to, my chief complaint seems to be a fall. I'm going to look for any life threats. Is there any life-threatening bleeding?
No active bleeding.
Okay. Now I'm going to assess my airway and breathing. And I'm going to come over here and check his airway. And is his airway open, or do I need to open with a jaw thrust?
Airway is open.
Okay. I'm going to check breathing. I'm going to rate rhythm and quality of breathing.
His respiratory rate is 28. Pulse is 140. Blood pressure is 72/60.
Okay. So his rate is 28. And so I'm going to go ahead and put some high flow O2 on him because he's unresponsive and respiratory rate of 28. So I'm going to put non-rebreather mask at 15 liters a minute. And I'm going to look for any obvious airway injuries. I don't see any at this point. And because his airway is open, does the O2 seem to be helping?
His new respiratory rate is 22.
So I don't think that he needs an airway adjunct at this point. Now I'm going to move on to circulation. I'm going to check pulse, rate rhythm and quality.
His pulse is 120.
Okay.
And you have no distal pulses.
Okay. Do I see any obvious bleeding?
No.
Okay. His skin, I'm going to assess skin color and temperature. And
His skin is cool, clammy, and no distal pulses.
okay. So I feel like he is going into shock. I'm going to start treating him for shock. I'm going to keep him warm, and he's a high priority transport. We're going to be transporting him as quick as we can. I am going to have my partner continue to hold C-spine while I do a rapid head to toe. I'm also going to have my other partner do vital signs and get a sample history.
Good.
And I am going to start, again, I'm sorry, I move really awkwardly and slow because I have a bad knee.
All good.
All right, so I'm going to start head. I'm going to palpate and inspect my scalp.
No obvious signs of trauma.
My ears, and I'm going to look behind the ears for any battle signs.
None found.
Okay, I'm going to further assess his face. So I'm going to look at eyes, any raccoon eyes.
No, his pupils are equal.
Okay, and I'm going to shine my light to check pupillary response. I'm going to check nose, mouth. Do I see any mouth?
Nothing.
Nothing in the mouth. My cheekbones.
Everything's stable.
Okay. Now I'm going to assess the neck. I'm looking for JVD, or is my trachea midline?
Everything is where it should be.
Okay. Going to palpate my C-spine for any obvious deformity.
None present.
So we are going to put a C-collar on at this point with my partner assisting.
Great.
We'll get that on. Now I am going to move to the chest, and I'm going to expose, inspect, palpate my chest. I'm going to listen.
You have obvious left side flow chest with a decreased breath sounds on the left side.
Okay. I cannot do anything about that. That's noted, but can't do anything at this point for that. And I'm going to listen to heart sounds and breath sounds. I'm going to move to my abdomen pelvis. I'm going to palpate all 4 quadrants of my abdomen.
You have a distended abdomen.
Okay, so noted. He is unconscious, so I'm going to proceed. I am going to check his pelvis. I'm going to press in and down on the pelvis for any instability.
And the pelvis is stable.
Okay. I'm going to check my knee. I'm going to get in a position. I'm going to uncross his legs and check my lower extremities. I'm going to inspect, palpate. I guess I'm not reaching over my patient either. So I'm going to inspect, palpate, check CSMs on both distal extremities. And
still no distal pulse.
No, on either side?
Correct.
Okay. All right. Again, noted. And I will come around to the other side to check. Inspect, palpate, check for pulse here, no pulse here.
Correct.
Okay. I'm going to come up to my upper arms, inspect and palpate, and check CSMs on my upper arms.
No distal pulse on the right arm.
Wow. Okay. And I'm going to go to the left arm. Inspect, palpate.
You do have an open injury to the left upper arm with capillary bleeding.
Okay. I'm going to have my partner hold compression on the bleeding to control that. And I am going, is there any need to check genitalia?
No, there is not.
Okay. And did he have a pulse on this arm?
No.
Okay. But he still does have a carotid pulse, correct?
Yes.
Okay. All right. Okay. So we are going to get him, I'm sorry. So I'm going to log roll him with the assistance of my partner holding C-spine. I am going to log roll him to check, and you can help me a little bit here. All right, we're rolling up. And I'm going to palpate down, all the way down, inspect. I don't see any obvious injuries. I don't palpate. We're going to be sliding I did palpate. We're going to be sliding the backboard under him, so when we roll him back down, he will be on the backboard. Again, while still holding C-spine. Okay. We're going to secure him on the backboard and load him in the ambulance to go. And in the ambulance, I'm going to continue to reassess every 5 minutes. I'm going to be checking that my bleeding is controlled. I'll be continuing to check my pulses. I'll call into to receiving to let them know of flail chest and know the lack of distal pulses.
Perfect.
And, okay.
Anything else?
I think that's it. Thank you.